Hi, Miss Jones.
Hi.
How are you doing?
I'm all right.
You're all right. Your doctor had an emergency in the hospital, and he asked me if I would see you. So I'm going to talk to you today, if that's okay.
Okay.
Okay, I need to pull up your visit in the computer real quick. We went to new computers, and I'm just going to type a little bit as we go to catch up and not get behind. So what is going on with you today?
Well, I'm just feeling I just don't feel good.
When you say you don't feel good, what does that mean?
Well, I just feel tired all the time.
Okay, let me see. How do you sleep at night?
I sleep okay.
Okay, I'm gonna pull up your lab work from the last time to see. Okay, you were here last in January, is that right? Does that sound about right?
Yeah, it was 4 months ago.
Okay, so January, and you had a thyroid test done and it was normal, but we probably just need to go ahead and repeat that because you're saying you're tired. So is there anything else going on?
Well, I gained weight,
How much weight did you gain?
20 pounds.
20 pounds since the last visit?
Yes.
Okay. Any other symptoms?
Well, I got a little shortness of breath and my knees bother me.
Which knee?
Both of them.
Both knees?
Mhm.
We have to click on this little diagram to show which knee, so both knees.
Yes.
If you had to say how bad your pain hurt, like out of 0 to 10, what would you tell me?
Maybe about a 6.
Anything make it better or worse?
Well, the activity and everything.
Activity makes it worse?
Mhm.
Okay, so you told me a couple of symptoms that you've had, the shortness of breath, the knee pain, the feeling tired. If you had to pick one that's bugging you the most, which one would you say is bugging you the most?
I guess just the feeling tired.
Okay, and how long did that start?
When I put the weight on.
Okay, so but since the
Gradually
last
forward,
visit, you just
yes.
kind of been starting to feel more tired?
Yeah.
Have you been eating more than before?
Yeah, because I got my grandkids, and everything, so I eat.
Hang on just a second. I'm trying to get used to this system, but it's kind of slow. Okay, I see from what the nurse wrote down in her note that you try to eat a variety of different foods.
Yeah.
Is that true?
Yes.
What would you like to change about how you eat?
I would like to eat more better so I could lose weight.
Okay. I'm glad that you want to do that. That's always a good thing, and we can set you up with a nutritionist that'll help you plan a good, healthy meal and also talk to you about exercise as well. Kind of getting back a little bit to that shortness of breath that you talked about, do you have any pressure, tightness, pain, anything else besides the shortness of breath?
No, just a little heartburn sometimes.
Just heartburn? And is it
Yeah.
after you eat, or is it just any time?
Like after I eat or I drink coffee, a
Okay.
lot of coffee.
Now what about snoring? Has anybody told you that you snore?
Yeah, my grandkids laugh at me. They say I make a noise when I'm fall asleep watching TV.
How often do you fall asleep watching TV?
Well, more lately since I've been so tired.
Okay. Do you sleep well at night?
Mostly, but sometimes I stay awake worrying.
Okay. Oh, rats, I got out of this. Let me go back and this computer system, I tell you what, it's good, but it takes a little time to get used to. So what about your, getting back to talking about the sleep and and being tired. What about your concentration?
No, I don't.
You have trouble concentrating?
Yeah, it's okay, but my mind do wander sometimes.
Okay. And I'm looking here again on your note from the last time that you saw the doctor, and it said that you were a little bit depressed and they started you on a medicine. How is that working for you?
Well, it's better than in the winter when I started it. I don't, not that I want to do anything to myself, but you know, life sometimes is just hard. I feel like it's hard.
Okay, let's get back to that shortness of breath. Does it happen only when you walk?
Yeah, pretty much.
Okay, so when you're sitting watching TV, no real shortness of breath?
No,
Okay, do you cough very much?
no.
Okay, well, let me look you over real quick and let's listen to your heart and your lungs, okay?
Okay.
Well, I don't really know for sure, but testing may be a good idea. Your heart and your lungs sound fine, so I don't hear any fluid, or your heart sounds good, but you could have sleep apnea, obstructive sleep apnea. Have you ever heard of that?
Yeah, you know, I got a brother that's got that.
Okay. Now, I don't know for sure if that's what you have, but we're going to refer you for testing, and that's just to make sure that you don't have sleep apnea or to say that you do. And what they'll do is you'll go in the evening usually, and they'll let you sleep, and they'll put monitors on you and evaluate you while you're sleeping. And then they'll determine if while you're sleeping, if you're having any episodes of apnea where you have episodes where you're not breathing while you're sleeping, or you're just waking up or having restless sleep. So we'll get that ordered, and I'm going to go ahead and put it in the computer. And when you check out front, they may ask you more information about the test, about what day of the week would work for you, but I'm going to go ahead and put it in, that we're going to order that test for you.
Now, I don't want to be on a machine now. I
Well,
don't want one of the machines.
we're going to refer you to the sleep doctors, and they're going to make that decision if you need a machine or if you even have sleep apnea, okay? We're going to try to figure out what's going on with that shortness of breath, okay? Okay, so I think we got everything ordered, okay? Again, I'm just covering for your doctor, so you're going to come back and see him in a month. I'm going to put that visit in for you to come back, and you're going to keep taking your medicines that he ordered the last time. We're going to get some lab work, and then we're going to order that sleep test, and you're going to come back and see him in a month, okay?
Okay.
All right. Bye-bye.